Patient safety is a critical issue, with nearly 400,000 deaths annually from preventable medical errors. It is the third leading cause of death in the United States. The more we learn about advocacy and collaboration with the medical team, the safer it is for our patient. Welcome to Wondercast, a community collaborative podcast supporting families navigating the complexities of chronic illness or injury. Wondercast is supported by the generous sponsorship of Texas Oncology. Texas Oncology, more breakthroughs, more victories, experts in cancer care. Today, we are joined by Laura Townsend and Dr. Charles Holshouser at the Louise H. Batz Patient Safety Foundation. Tune in as we delve into the critical issue of patient safety and the vital roles that families have in advocating for their patient. Meet Laura and Charles.
Laura Batz Townsend with the Louise H. Batz Patient Safety Foundation. I'm one of the co-founders of the foundation that we started April of 2009. My mom died April 26, 2009, so we're coming up on the 16th anniversary. So it's been quite a journey and a lot we've accomplished and gone through over these past 16 years and learned a whole lot about patient safety and advocacy for patients and families and working together with hospitals and doctors and nurses and all that kind of good stuff. So that's me.
Just appreciate you having us today and letting us get together to talk about patient safety because it's a topic that's dear to our hearts. But I'm Dr. Charles Holshouser. I'm a retired obstetrician and gynecologist, trained at Southwestern Medical School in Dallas and was in the Army for 8 years and practiced in San Antonio from 1979 to 2018. Became acutely aware and involved in patient safety when my sister, Louise, died in the hospital from excess sedation after a knee replacement. And I've journeyed with Laura along the last 16 years as we've worked with different hospitals and patient safety advocates and different groups that are trying to improve patient safety. It's a continuous process.
I guess I'll start, April 26th is coming up, but it was in 2009. My mom had to get a knee replacement done, and it was right around a little bit after Easter that she was going in. And my mom had, she was one of these people that dotted every I, crossed every T. We grew up in the medical community of San Antonio. We have 5 doctors in our family. So I feel like we've always been really spoiled by our healthcare. Charlie actually, assisted on delivering both of my babies because I was going to make sure that they both came out safely. And, we never ever really were concerned about it. And my dad had quintuple bypass surgery 2 months before that in January. And so when you hear the word quintuple bypass surgery, you're like, oh my gosh, that's the big one, right? That's huge. And so, everybody was around my dad for that. And then when my mom had to get a new knee, they're like, this is no big deal. You're going to be in and out of the hospital in 3 days, right? So I think you have a very false sense of security when people tell you that. My mom went into the hospital, and in the pre-op room, when you go in for your pre-op, they get you all set up, and it was myself and my dad and my Aunt Joanne. None of the doctors in the family, but we felt like we knew what we were doing. I think as a family and a patient, you feel like if I can just make it through the surgery, everything's going to be okay. You kind of feel like when they go back, that's the really scary part, right? That's what you have to worry about. And my mom went back, and it was about an hour and a half. And, we were so nervous, so worried. My mom, she was a very healthy person. The last time she was in the hospital is when she had me. She didn't drink, she didn't smoke. She was always just really healthy, took care of herself. And an hour and a half went by. The doctor came out and said she had a beautiful new knee. Everything went so well. Everything was great. So we were just so pleased. Like I felt like the weight of the world kind of went off our shoulders. At that time, I had a little one. My oldest was 4.5, and I had a baby. So my brother had a baby boy who was about 3, and then they were getting ready to have their next baby boy in June. So this all was like, kind of like the golden years for my parents, this wonderful time for them. And we were just so thrilled that on to the next stage. My mom went into the floor, the orthopedic unit after the surgery, and she was given a PCA pump, which was 2 milligrams of morphine at the time. That's patient-controlled anesthesia. It's like, that's what they have. Anyway, my mom had never taken anything more than like an Advil, right? She just didn't take a lot of stuff. And so around 6:00 that night, they'd given my mom a creamy soup, which made her feel a little nauseated. And so they gave her a drug called Visceral, which is a pretty antiquated way to treat nausea. Now they give you like Zofran. You might hear of Zofran, which doesn't make you sleepy. And there's also a drug called Finagrin that does make you very sleepy. That'll knock you out. But it's in that sort of same class. A Vistral is sort of like taking a Benadryl. So it's a depressant. And then around 8 o'clock that night, I brought my daughter back, Ella, my oldest one, not the baby. And, we brought flowers and balloons. And I was so excited that, my mom always had a beautiful smile. She just always lit up a room. And I know she wasn't very comfortable at the time because she had the big knee contraption on and things like that. But she saw Ella and she just lit up, was so happy. And I'm so glad that Ella got to see my mom one more time. And then we took her back and I came back to the hospital and it was around 10:30 that night. And it was my Aunt Joanne and myself and my dad. It's sort of like the Titanic. You kind of see it all kind of unfolding when you look back. But I remember, Charlie called and was like going to head to the hospital to see mom. And mom was like, don't worry about it. Everything's fine. It was a late night for Charlie. I think he probably just delivered a baby. And then my brother, who's in Dallas, who's a radiologist, and his wife is a urologist, they were going to come down over the weekend. So, they called and everything seemed fine. And the nurse was lovely. We probably spent 30 minutes asking her all types of questions, how the night was going to go. We asked 1,000 questions. And then we asked, what's the protocol for the rest of the evening? Because they kind of wanted to kick us out and be like, it's time for you guys to go home. They're probably tired of us. So we asked what was going to happen while we were gone. And they said that they were going to give my mom the Vistral and then Demerol and then morphine. And I was like, wow. So the 2 different types of pain medications on top of a Vistral. We're like, well, that's a lot of medication. And so then they asked my mom what type of pain she was in from 1 to 10. And that pain scale is a very tricky one to answer. And my mom said, I have no idea. Like, I have no idea what is 1, what is 10. And they said, do you feel like you're having a baby? And we're like, she's like, no, this is no big deal. This is not like having a baby. I'm fine. So we asked them to only please give her the PCA, the morphine, and that was it. And she wasn't nauseated anymore. She didn't want the Demerol. And so I gave her a big hug and kiss and I told her how much I loved her. And I was so proud of her. And Dad and I went home. It was probably the first time my dad was without my mom at home in 50 years. And then it was at 3 o'clock in the morning, we got a phone call from the hospital that my mom was having trouble breathing and to please come. And of course, totally panicked. And my dad and I got in the car and we called my Uncle Charlie and he's like, it's okay. It'll be fine. It was probably just, they'll probably just moved her to a telemetry floor and another floor. It's going to be okay. And then I called my brother and then he started to panic. He's like, oh my God, did she have a pulmonary embolism? Something like that. And so I was like, oh Lord. And so then I started to panic again. And I got to the hospital and I'll never forget, there was a security guard outside my mom's door. So I just started running and I left my dad behind and I opened the door and it felt like 1,000 knives had just gone through my body. My mom was just laying there pretty much lifeless. The only thing keeping her alive was a handheld oxygen thing that the nurse was doing to keep her breathing. I was like, oh my God, what happened? I just left her. She had a smile on her face. Everything was great. Everything was awesome. Life was great. Well, it turned out that they gave her the Demerol, morphine, and Vistral at midnight. And they had no monitoring on her at all. Nothing to help protect her. There was no pulse oximetry on her. There was nothing to monitor her heart. Their standard of care was once every 4 hours. So at 3:30, my mom went into respiratory depression and suffered a anoxic brain injury. It didn't take us long to figure out, wow, this wasn't supposed to happen. Are we the most unlucky people in the world? Or does this happen to other people? Did we just get struck by lightning or something like that? So as my mom was on life support for 11 days in the hospital, I started doing research. What is a preventable medical error and how often does it happen? Are we just the unlucky ones? And to my horror, I saw that almost 400,000 people die a year from preventable medical errors. So then I went to the CDC and I started to look, well, where does that fall into the list? Well, it's not there. It doesn't exist in the CDC list, but it's the 3rd leading cause of death behind heart disease and cancer. My heart just sank. I was like, wow. How did we not know this? How did our family of medical doctors not know this? I had to take my mom off life support. It is not like it is in the movies. It is not. It is a horrible, terrible thing. And that night we wrote the mission for Louise H. Batz Patient Safety Foundation. Her life wasn't going to end there. That wasn't going to be the end of her story. And we wanted to be able to help other people not experience the pain that we felt. And we still do, So it's been an amazing journey from that point on. It's been a journey from tragedy to hope. And what we've been able to accomplish, we've raised close to $4 million for patient safety. We had to figure out, I wanted to figure out if I could have 24 hours back, what I wish I could have known, what I wish I could have done to help save my mom's life. You wake up and think, how can I do that again today? And then how can I use that to help other people in the future and right now? Like, how can we help people? The medical world is complex. There's a lot of government, entanglement. There's so much bureaucracy on top of it. There's so many things. And I didn't want to get involved with trying to change a system that's been really hard. I wanted to figure out how can we help people right now? And so we had to figure out the root cause analysis of that. We met with all the hospitals in San Antonio. They really embraced us. And we came up with really 3 things. One was a lack of teamwork. I always say we had a great nurse, great doctor, great family, great patient, but great players don't make a great team. We were not a good team that day. We did not communicate well with each other. We all lived on our own island. The second thing was a lack of knowledge. We asked 1,000 questions that day. We just didn't get lucky and ask the right one. And you never want to go in the hospital hoping that you're going to ask the right question. I wish that we had had a playbook, and I wish that we had had that, because there's nobody knows you like you or your family. And so we could have been the valuable member of that team if we were given the opportunity and we weren't just sent home at midnight. Third was a lack of technology. I always say they gave my mom all that medicine. It's like you put somebody in a car without a seatbelt and a helmet going 200 miles per hour and say, I hope it works out for you. That we don't need to do that. We have all the technology in the world to make sure that doesn't happen, and they're not using it. But to monitor a patient once every 4 hours is not right, and it should never happen, because at 3 hours and 30 minutes, my mom was dead. So she had nothing to protect her in the hospital. And when you're putting drugs in somebody, you don't know how they're going to react, because every human is different. Every standard dose is different. We hear this all the time, that in the real world or outside the hospital, people are accidentally overdosing, right? Maybe they take an Ambien, then they go have some alcohol, and then they take a painkiller and they die in the middle of the night. But they didn't mean to, but they overdosed, right? They're doing this to themselves. It is a huge problem in this country that we're facing. And for her to be in a hospital setting and for that to happen is really terrible. And so what we did from that point on is that we wanted to make playbooks, basically. How can we help people navigate the hospital experience? And so from that time, we've developed the Batz Guide for Bedside Advocacy that takes you through your whole hospital journey, and it takes you through every step, before, during, and after. We have it in English, Spanish, Dutch. We have it for pediatrics, for transplant patients, for babies, for breast cancer patients, so many different specialties. We've become international. We have a team in Europe, a team in South America, really trying to, once again, create awareness, because we do believe that stories save lives. I believe that my mom's story saves lives. And every time that when people have heard our story, when they heard it speak, it's not easy to speak it. I cry every single time. It's been 16 years. I'm never going to not feel that same pain. But when you have people come up and tell you, a nurse or somebody like that comes up and tells you they heard my story, they're like, I never ever give a patient medicine without thinking of your mom. I try to do it right. That's what saves lives, right? That's the hope, right? That comes from the tragedy that my mom faced. Creating something that can build a bridge between the patients and the families and the doctors and the nurses and the medical team. Medical jargon is hard to understand. I would tell Dad, are you taking an Advil? He's like, well, I know I only take ibuprofen. Every drug has 4 different names, right? So it's very, very confusing. And so we all understand that. So how can we bring it down to the level that everybody can understand? Because that's really what you have to do, is to feel empowered as a patient and family, and to ask as many questions as you can. I always say there's no bad questions, right? What's it going to do to ask a question? It might stop somebody for 5 seconds, but you know what? You could save your life. It's no harm, no foul, right? You move on. If it's not, does it mean anything? Then great. But maybe it did. This is what we've been doing for the past, almost 16 years now. And, it's been a incredible journey of turning something tragic into hope. We come at a unique perspective, because I'm really the advocate and the patient, because I don't have the medical knowledge. But Charlie and my brother and all the family members who are doctors and our family, we have that medical knowledge. So it's a great teamwork, and our foundation is unique in that way in what we're doing, because we can come at it together in a united front to try to make change.
Certainly, on a personal level, in my practice of medicine up till that point of time, which, I graduated medical school in 1972, and had been in practice either in the Army or in civilian life, through that period in 2009. So I had seen a lot of changes, a lot of things happen, but I really had no idea, of the extent of the problem of lack of patient safety, of the experiences that people were having in the hospital that you just didn't hear about. I knew what was going on inside the obstetrics and gynecology department, because we kept all those records and we would talk about those at our conferences. But I really wasn't aware of what was going on in, the other departments around the hospital. So we started researching it and found, articles in the medical literature saying 150 to 200,000 deaths a year from maloccurrences inside the hospitals. And that was shocking to me. On a personal level, when that happened to my sister, I think it was like a Wednesday morning when all this happened. And I was expecting someone from the hospital to come and talk to the family and say, we're sorry that this happened. We will look into it to find out what went wrong. We'll try to make sure it doesn't happen, but it did not happen in that hospital where my sister was being cared for. So on the Friday afternoon, I went down with my white coat on, saying, I'm a doctor, and went into the administrative office and told I need to speak to the administrator. And because I'm a doctor and I know what's supposed to happen, and I know if what's supposed to happen didn't happen, and you need to come up and explain to my family what happened and that you're sorry about it, and we're going to look into it. And it wasn't until I did that got any kind of response. But that helped to spread the word because people know me in the medical community here in San Antonio. And it turned out that the chief medical officer at that time for the hospital system where this happened was an obstetrician gynecologist who's a friend of mine. And so she immediately became involved in it and is still involved in the foundation and has helped us all these years. Also, the head nurse of that hospital system came to us immediately, said, this couldn't have been worse. This shouldn't have happened. We're going to look at it with you, and we're going to figure out how to make this not happen again. And immediately we began looking at the doctor's orders at every hospital in San Antonio for post-op pain medicine. And we came to the conclusion that there were many modifications and improvements that we can make in the way the doctor's orders were written. So that was done immediately, so that every hospital in San Antonio at that point switched over to basically the same post-op pain medicine order sheets. The hospitals really joined with us in this effort and enabled us to come into the hospitals and help do things like look at the order sheets and spread the word about patient safety. And of course, Laura set up the foundation, which gave us a template, a platform that we could use to help spread the word about patient safety. She's done an amazing job with it, and we've had amazing response from the medical profession. What we find today is that it's still a problem. The pandemic, that certainly caused a lot of burnout in the medical personnel. Nurses and the doctors really had a hard time dealing with what was going on inside the hospitals at that time. How to make it better is what we're looking at now. Laura mentioned technology. We have the technology right now, today. It's available to monitor every patient in the hospital for their respiration, their heart rate, and their blood oxygen levels. We shortly will have the technological computer availability of monitoring all the patients that are in the hospital, their laboratory work, their x-rays, their ultrasounds, all the information, their vital signs, all the information that we have will go into the central computer. And the computer, should the hospitals choose to begin using these systems, the computer will notify the hospital personnel when any patient is beginning to degenerate and go downhill, based on the information that's coming into the computer. The hospitals have to decide that they're going to spend the money to embrace this technology and use it if we're going to make really significant progress in taking care of patients. The whole team has to work together. There has to be transparency. There has to be communication between the nurses and the doctors and the patients and the patient's family. And like Laura said, we all have to work together to get a good outcome when we can. Sometimes you're faced with a disease that is at the end of its stage. There's nothing more to be done. You go to hospice and you try to make them comfortable in their last days. But healthy people and even people with problems should be able to go into the hospital and get care that is going to help them and not get care that's going to kill them.
Well, I'm thinking of our listeners here. Even like me, my daughter is having a very tiny surgery on Thursday. It's super easy, nothing to even really worry about in this stance of disease, right? But for our listeners who might be thinking, I have this huge surgery coming up, maybe a double mastectomy, maybe I have a pacemaker being put in, something more invasive. How would they even go about navigating what questions? I guess you guys said that you've created these tools. how do they access the tools?
Yeah, well, so you can go to our website, at www.louisebatz.org. It has everything on there. You can download it, or you can get, our guide on Amazon too, and you can reach out to us and we can send them to you. But it has those questions for you to kind of help you navigate your stay. I don't think any surgery is too small. I think the most important thing is that you communicate with everyone through every part of the stay of your visit, right? In my mom's case, my mom had undiagnosed sleep apnea. It's a stop bang survey. And, there's 30 million people in this country that are undiagnosed with sleep apnea. And it's an easy little test that you can do. I think my mom probably failed almost every question. They had done that type of questionnaire beforehand, the trajectory of her care would have been different. One hospital might do that survey, but another one might not. There is no same at a hospital. When you go onto an airplane, maybe the seats are blue or orange, or, the planes are different colors that maybe they offer you, like you've got to pay for luggage or not pay for luggage, but that all the safety regulations are the same, right? They all have to adhere to the same type of safety. My biggest tips are, 1, ask about the stop bang survey on sleep apnea. 2, make sure you write down all the medications that your loved one is getting and track that. We have that on our website. You can download it and have your own chart, or you can use a notebook if you want to, and make sure that you're writing that down. Make sure that your loved one is continuously monitored. Make sure that there's a pulse oximetry monitor, an EKG, something that is monitoring your loved one continuously. Do not let them say, oh, we only do it once every 4 hours. You say that my loved one needs it. We're going to have it done this way. I also say another big thing is that every 12 hours is Groundhog Day, because every 12 hours is a shift change. So you've got a new person coming in. You've got to start all over again with any allergies your loved one might have, anything that's been going on, because you are the only constant. The family really is the only constant in your loved one's care. Every 12 hours is Groundhog Day. And so to really, really, really make sure that you start all over again. Don't assume that the new nurse is going to know everything that the nurse before knew, or that the older nurse that was there before is going to tell the next nurse, even at shift change, that she might forget something, but you won't. So make sure that you're always there. I always say, don't leave your loved one at night if you can help it. I know that most likely they're not going to be in the hospital for that long. I know it's kind of a pain to spend the night, but if you can just do it for a couple days, it can really make a difference, because those early morning hours are hard. Now, if you can't be there, what I always do is I set an alarm and I just call the nursing station every hour or so. I would call to say, how's dad doing? How are they doing? How's his medication? So it keeps them on top of what's happening, right? It signals them, well, I better go check just to make sure and look. And so that's great. And the nurses are always very nice to help with that. You're not being a pain or distracting. I had no problem doing it. And it's easy to set that alarm and to make sure you check on their vitals. My dad was sort of our guinea pig, because, 6 months after my mom died, my dad fell in the bathtub and crushed his spine. And so he was in the hospital for 6 months. And, so many times we caught a medication error all the time, so many different times. One time my dad got 15 times the amount of medication he was supposed to receive, but we caught it. We wrote it down and we worked with the nurse and we figured out what was happening, right? And we worked together. And so that's why I'm saying it's nobody has to feel like they're the bad guy or the enemy or anything like that. They're here to help you and you're here to help them. Help me, help you, right? And so we worked together and everything was great. Those are always sort of my little tips that I give if I could just tell anybody, and never think that there's any bad questions, because there's not.
If you have maybe somebody who in your family is going to have a surgery that really can't be put off, maybe it's some sort of repair that they're having that's very important for their disease progression to have it as quickly as possible, but you feel like there is that medical resistance to them asking a lot of questions, what guidance do you have for those families? Because I think they carry that weight of we really need this port placed, or we really need this double mastectomy to be able to move forward in our care. But I feel like we're annoying the doctor, we're annoying the nurse, and they're not answering our questions. What advice do you have for them?
Well, what I would recommend is that, again, that you establish a relationship with the nurses and the doctors that are taking care of your loved one, and you get a sense of, are they looking in on the patient? Are they checking the labs? Is the patient on a monitor that's being observed out at the nurse's station? Is your loved one just sort of being ignored and no one's coming in to check unless you call for them to come in? And, they have lab work that morning and it's that night and you're not getting any results. You ask the nurse, how'd that blood work from this morning turn out? And, they really don't know. They're going to have to look it up. And, an hour later, you still haven't heard. So you get a sense of that it's just not happening the way that it should. And if that happens, then you just ask to speak to the hospital administrator on call. Every night, there is a hospital administrator on call in every hospital. And if there is a problem, you get that administrator in to check on your loved one. They will get to the bottom of it. They're not taking care of other patients. They will find out for you. So I think that is the thing. If you're not getting the response that you should get from the nurses, do not hesitate to ask for the hospital administrator. You just call the hospital operator. You get the operator on the phone. You say, "This is who this is, and I'm with my relative in room 720, and things are not going the way they should, and I need you to come and help."
I do think that you do have a generation of people who don't want to bother the doctor, don't want to bother the nurse because they feel like, well, they're smarter than them. They know what they're doing. I shouldn't bug them. We really have to get out of that, right? Because like I said, nobody knows you like you. So you are the most important person in that room. The patient should always be in the center, the most important, the patient, the family. We all live on different islands. Here's the doctor's island, the nurse's island, the patient's island, the pharmacist's island. And we wanted to bring everybody together. And I think that's, was so important. And I also want to say on medication, if you are ever worried or you don't know what that medication is that somebody's they've given your loved one and you need more information or you're worried about the combination of a drug, Walgreens, 24-hour Walgreens, the pharmacists are the best. You could call the 24-hour Walgreens or CVS or whatever it is, and the pharmacist knows everything about medication and they will tell you.
I know that you guys have done such a beautiful job of having your documents and your communication tools translated into different languages so that they're easier to use. For our families that are maybe going to a hospital where the staff is trying to speak to them in English and English is not their first language, would you say that every hospital now has access to interpretive services of some sort via the telephone or telehealth? Or
a lot of hospitals do.
Because we have 26 different languages that are spoken in San Antonio. And so when people come to the hospital, you have no idea what language you may need. And now with these phone systems, they can get somebody that can speak Swahili or whatever, and they can translate for you, and you can have a meaningful discussion with the patient now without any trouble. And that should be available in every hospital now. I don't see any particular reason that wouldn't be available around the whole country.
So then it just goes back to advocacy. Really, if you're ever feeling like you're not being heard, don't be afraid to speak up and say, we need to say it differently.
You're the customer, right? Would you go to a restaurant or buy a car or go to a hotel and not speak up, right? It's customer service at the end of the day.
Now, I want to be mindful of your time. Is there anything that you want to share with our listeners, any takeaway that you hope after listening to this, the one thing or two things that they just really can carry with them?
My oldest daughter, Ella, she was almost 5 when my mom died, and she loved my mom just so much. And when we would drive back to Austin, she would see the hospital. And one day she said, "That's where they killed grandmother." And I go, "Oh God, no. That's not what happened." I said, "The system failed everyone." And I said, I never wanted my kids to feel that. They should be thinking of unicorns and rainbows, at that age and everything happy. No kid should feel that, right? Or say something like that. And that's why one of the reasons why we started the foundation is to leave that legacy. And a few years later, I was stuffing end of year letters and she goes, "Mama, I want to help you. And I want to be part of the foundation." I was like, "Absolutely." So she started stuffing the letters and putting stamps on it. And she looked at me and she goes, "Mama, it's so sad that grandmother had to die, but I know that we're saving so many people's lives." And I go, "There's the hope." She started her own campaign when she was in middle school, and she said she wanted to make bracelets. You know how they love the rubber bracelets. And I've always said I always wanted to make a bracelet, but I really didn't have any idea what to put on it without having a paragraph, because I talk a lot, as you can tell. And she goes, "Mom, I think what you're really trying to say is empower. If there was one word to say, it's empower." And I was like, "You know what, Elle? I love it. That's great." And so we have, our purple empower bracelets and that we have on there. And if there's one thing is empower yourself, I know it's such a time when you're never more vulnerable in your life than when you're in a hospital. They've taken off all your clothes, your money, your jewelry, everything. You are literally, just so bare and you're scared and you're emotional. And so it is very easy to not feel empowered. It's easy to feel powerless, right? And this is the time when you're going to have to just kind of look down at that bracelet and say, I can be empowered. And these people in this hospital, they do want to help you. And for that moment, they become part of your family. I tell these nurses and doctors, you become part of their family when they walk into that hospital because you know the stuff about them that nobody else does. And we just want to you want to get that person out, right? And you want to get them to the other side and you want to be part of that team. And so I think that's really, to me, is so simple. Empower each other all along the whole continuum of care.
Remember to establish a positive relationship with the people administering care to your loved one or to yourself. You are a unique individual and you deserve their attention.
Why we were so spoiled by our healthcare is partly because of Charlie. And I'll tell you that he's delivered so many thousands of babies. And there's not one place that I don't go when I'm with Charlie that usually someone doesn't come up and say, Dr. Holshouser, how are you doing? You delivered my babies. And they come to him, no matter if we're at the beach, if we're somewhere in San Antonio. We were speaking at Incarnate Word. We go and speak every semester and do a nursing class there. After the class was over, a student came down and said, Dr. Holshouser, you delivered me. I mean, that's the impact, right, that I think that he had. And I think that's where all doctors should be. You have that relationship that you made such an impact that the child, that the baby knows who you are, right? And I think that says a lot, right, about a person. And I think that's huge. And that's the type of care that, everybody, that we all want, right? And that's kind of like the bar that needs to be set, is that everybody wants that. So, and it's possible, right? It's 100% possible.
Thank you for tuning into our podcast today. Please subscribe and continue to check back as our content is ever evolving. For questions or specific content-related requests, please send an email to podcast@wondersandworries.org.